For too many, taking care of their oral health is overwhelming. Limited access, financial inequity, siloed care. We're changing that. Changing it for all of us. Smile Health set the goal. 15 weeks later, 5 cutting-edge solutions are transforming sleep, early cancer detection, and preventative care. Welcome to Smile Health. It's demo day.
Please welcome to the stage our host for today, Maria Filipova, Chief Innovation Officer for CareQuest Innovation Partners and the CareQuest Institute for Oral Health.
Wow, I didn't know I have a sound effect that comes with me. Hi everyone, good afternoon. Hello, I'm so very happy and grateful to see so many familiar faces in the audience today. So many old friends, so many new friends coming together to transform health and talk about how we are all contributing to that shared vision for more equitable, integrated, and accessible oral health for all. I'm very pleased to kick us off today with a couple of remarks and ground us in the reason why we all do this. And it really starts with the patient. I want us all to think about the last physician visit we all had, or the visit that we took our children to or our loved ones to. And think about that visit and reflect on how you felt before that visit, how you felt after the visit. Did you really have a conversation about your health overall, or were you having a conversation about a very specific, specialized topic that you were seeing that physician for? And don't only think about your dental visit. I didn't ask you to think about that. I asked you to think about your last medical visit. And that's important because in our vision, in our transformed view of health, the oral health conversation is a conversation that happens at home with your dentist, but also it happens in the community with your church, with your medical physician, and with the broader community. The reason why that's important to us, and as we think about oral health, we want to think about good health and the fact that good health starts with your mouth and the health in our overall microbiome. And I do want us to reflect for a moment on the integrated nature of that whole person health. We know that poor oral health can lead to serious and sometimes irreversible medical conditions. We know that if we brush our teeth less than once a day, that is linked to the development of obesity. We know that chronic gum disease has been associated with higher risk of developing Alzheimer's disease later in our life. And most recently, we're seeing that we are going to be at an increased chance, up to 21% higher chance of developing dementia. Untreated gum disease makes it harder for people with diabetes to manage their blood glucose level. We know that the increased number of dental caries or missing teeth has been associated with increased incidence of pneumonia as the bacteria from your mouth gets pulled into your lungs. And finally, I don't mean this to be a scary list, but I do want us to think about that connectedness of how our lifestyle and our oral health, our oral hygiene, and including minor gum injuries may have influencing or be found to have to be some of the biggest causes for endocarditis. And as some of the clinicians in the room could tell us, that is inflammation of your heart that's infectious and fairly serious. And so when you think about the connection from oral health to your heart health, lung health, mental health, your overall well-being and ability to be a contributing member of society, that really grounds us and sets the stage of why we do what we do, and we pursue it with the passion and the urgency of a patient taking care of their own health and of that of their loved ones. And so with that patient-centric view, I want us to think about the implications not only of poor oral health on our overall health, but on the economic cost that it actually impacts overall our society. We know that we are losing up to 34 million of school hours and 164 million of work hours due to oral health problems and unplanned dental care. We know that there are over $500 million that are spent on dental ED visits that could have been prevented with routine oral hygiene and care. There is estimated about $1,800 per patient of medical costs associated with missed opportunities to treat patients in that interconnected way. And the one that really gets me the most is our children, the future of the leaders of that healthcare system. 1 in 3 of children miss school due to dental pain. In some cultures, dental pain, as we'll hear later on, is assumed that it's normal, that there's nothing we can do about this. And that's the microcosm of interconnected factors and barriers that make accessing oral care so much more difficult for some of us. We know that Black adults are 22% less likely to have had a routine dental visit in the past year, even though they're 68% more likely to have unmet dental needs. We know Latino adults are 52% more likely to report having difficulty doing their job, or very often due to poor oral health. Folks who are living in the poverty experience some of those inequalities even more severely than others. And I wanted to start with that sobering statistic of the reality of how unequal and inaccessible oral care could be for some members of our society, because that really is what keeps us motivated to keep finding other ways to deliver care. And the solutions are not only technology solutions. The solutions are different levels of engaging with each other, connecting the dots, and systemically changing the way we help our communities. We know that the investing in oral health innovation continues to lag spending. Over the last couple of years, oral health spending has continuously increased, and we're seeing that in 2021, it reached almost $160 billion. An investment in VC, investment in innovative oral health companies, was about less than $1 billion in 2020, a little bit over $1.3 billion in 2021. The investment, a VC investment in oral health innovation is about 1%, 1 to 1.5% of the total VC investment. Yet oral health spending represents over 4% of our total spending on medical care. We're here to change that. We really believe that that investment is lagging, not because there is shortage of need or problems to be solved, or even shortage of solutions. We believe that with the right ecosystem, with the right platform, data, connections, and understanding of what it takes to transform and connect care across silos, that number and statistic could change. For those of you who know me, I study innovation at scale. And maybe there are many ways you could describe me, but probably patient is not one of them. And so when I look at how long it takes to scale an innovation, solution, technology, process, I always ask myself, how long does it take to go from an idea to wide-scale adoption? The last time we had a large-scale transformative innovation in oral health was 77 years ago, when in 1945, fluoride was discovered and added to the drinking water in Michigan. Talk about large scale. And I love this example because it doesn't require us to go and use quantum computing and blockchain and you name your next favorite flavor of the day. It was truly focused on what would serve the patient and what would reach the largest number of. And so time is, we are ready for change. For those of us who are motivated, maybe sometimes frustrated patients, we understand that the system we have today is delivering the results that are suboptimal for many of us. Yet we know that the system is designed to deliver the results that it's producing. With that in mind, we're looking to shape and co-create different models of the system. And CareQuest Innovation Partners was designed with that bold, daring vision in mind. We wanted to validate and scale transformative solution in healthcare that transform overall health through oral health. Our ambition is to advance oral health innovation and connect it to our overall health as a whole person contributing to their community. And how do we do that? We have 6 different capabilities. We run clinical studies that develop a body of evidence that connect the validity of those breakthrough innovations and their impact on clinical systemic health. We catalyze solutions, and what we're celebrating today, Smile Health, is a bright example of our ability to find promising ideas and solutions and propel them to adoption. We pilot those solutions that we have deemed high potential and high impact and aligned with our mission. We invest in the solution. We deploy our impact investing capital with the bold vision to invest in solutions that would have transformative impact that few are daring to invest in. Again, 1% of total VC capital invested in oral health, early stage oral health innovations. We believe that we are one of the few organizations well positioned to understand and validate some of those promising solutions and truly drive their impact. Our return on effort is measured by that impact and how widely we can scale the solutions we invest in. We partner with like-minded mission-driven organizations across the system, and we finally help large organizations like large benefit providers, integrated clinics to deploy some of the solutions we have validated. Our intent is to create a platform that's part of a bigger ecosystem that truly brings together all tools that are necessary for that large-scale transformative solutions. And we're so grateful to have all of you as part of our journey in that front. I would love to talk to you a little bit more about Smile Health and Catalyze, which is one of the 6 capabilities we bring to the table. As many of you know, a year ago, we posed a challenge to the innovation communities, the high-tech communities. And the challenge was, how can we provide equitable, accessible, and integrated oral health care to improve health outcomes? Many of you met the challenge, and we were able to create this unique program that cultivated over 100 entrepreneurs globally. And when we asked ourselves, what needs to be true for a program that is not yet another accelerator program or a boot camp or an incubator, what would make a meaningful difference in our ability to validate high potential solutions and also line up a series of small scalable wins for them so they could be ready for wide-scale adoption? And so our answer was threefold, and this became the foundation of how we created and designed Smile Health. Number 1, we wanted to start with the mission. We are committed to improving oral health for all. And you'll hear later about that shared mission with the CareQuest Institute for Oral Health. For us, that was foundational. Number 2, we wanted to design the program and the whole experience for impact. All of us still have some of the bruises from being entrepreneurs in large organizations or external entrepreneurs who are trying to scale solutions who were not, without fully understanding the dynamics and the barriers in the system, the incentives, the requirements, the integration need from patient flows and workflows. And so we really wanted to design the program by inviting some of those key stakeholders in the ecosystem, our impact partners, who allowed us to understand what are the technology requirements, the clinical requirements, the regulatory requirements for that solution to be successful in the hands of clinicians, dentists, patients, and administrators. And finally, we really stood true to our daring ambition to co-create the future. We know that the best way to predict the future is to create it. We believe that it's even better if we co-create it with mission-aligned, like-minded partners. And with that in mind, that collaboration and co-creation in mind as a principle is how we designed the program, we chose the solutions, and curated the ecosystem of partners who came to do that with us. This is some of the result that you saw from the program. Today you will hear from the 5 cohort participants for 2022. We're incredibly proud of the diversity of the cohort. We are incredibly humbled by their ability to adapt, learn, and stay committed to making care more equitable, accessible, and integrated. And what you will hear today throughout their presentations is not words. You will hear the actions that they have taken and the small, scalable wins they have lined up ahead of themselves to make sure that those 3 words, equitable, accessible, and integrated, is the impact that they're driving when they leave Smile Health. I couldn't make those opening remarks without taking a nod to our partners. This has been an impressive 15 weeks where so many of you came together. This is just a small representation of the partners that we have brought in. And as I mentioned, every one of our partners and startups has worked really hard in the last 15 months for no other reason but to really demonstrate that we could all drive systemic change in a very rapid way. And I couldn't be prouder to be able to go through that journey, a year-long journey now since we started, than having a partner of ours who understands our mission and is bold enough to co-create that future together, Matter Health. And with that, I'd like to introduce Steve Collins, who is the Chief Executive Officer at Matter. I don't know if you have an innovation officer. Maybe you are an innovation officer as well.
You looking for a job?
No, not yet. Let's see how today goes. But yes, with that, I'd love to introduce you, and please share your experience about Smile Health and what has been working with us.
Yeah, well, thank you, Maria. I always love listening to Maria talk about CareQuest and the vision, her vision, and Maisha's vision for the organization because it resonates so much with us. So our mission at Matter is to accelerate the pace of change of healthcare. And we built Matter on a foundational belief, foundational premise that collaboration is the best and maybe the only way to really do that and affect change at scale, to deliver real change in healthcare is going to require entrepreneurs. It's going to require the established parts of the industry. It's going to require health systems. It's going to require clinicians and investors and a whole constellation of individuals. The way that healthcare works is not intuitive. It's not rational in many respects, and the problems are complicated and vast and myriad. And the ways that we're going to solve those problems are by working together. So we built Matter as a not-for-profit entity with a goal of creating this neutral platform to facilitate collaboration. We developed a business model where we essentially do 3 things. One is we incubate startup companies. We've worked with about 750 companies since we started in 2015. They have, between them, raised close to $5 billion to fuel their growth. We have a suite of services to help them at every stage from inception all the way through to scale. The second thing we do is work with established organizations. Could be CareQuest, could be health systems, could be big life sciences companies, big insurance companies, big technology companies, companies that are interested in better harnessing innovation to improve health. we work with them to help them innovate better. We help them find the right entrepreneurs to work with. We help them structure and build collaborations that are ultimately meaningful and can be productive. We have insights and training capabilities, all designed to help those organizations be better innovators and ultimately to better collaborate with entrepreneurs to build the future of healthcare that everybody is envisioning down the road. And the third thing we do is we're a nexus for the healthcare community. For people who are passionate about healthcare innovation and healthcare transformation, we bring people together to be inspired, to learn, and to connect with each other. And we started the initial conversations, I think, close to 18 months ago with CareQuest, where they were interested in building something novel, building something meaningful that would have transformative impact that you heard Maria describe. And we were really attracted by that. We haven't played much in the oral health space, shame on us, but we're excited to be here now. We did our own research, found the same data that Maria shared, that as a percentage of healthcare spending, oral health is 4 to 5%. As a percentage of healthcare innovation, if you measure that by investment dollars, it's 1 to 2% or 1 to 1.5%. And that just doesn't seem acceptable. And from our own experience, we run into and work with innovators in various parts of healthcare all the time. And we don't run into the same, the number of innovators who are focused on oral health that we run into isn't commensurate with the scale of the needs, isn't commensurate with the scale of the opportunities, and isn't commensurate really with the industry overall. So we were very excited to partner and collaborate and build something that we could, that we believed would help catalyze more innovation, that would help propel innovation, that can really start to make a real difference in oral health and can start to change the narrative around oral health innovation. We have been delighted with this partnership and this collaboration and this opportunity. Working with Maria and Kirill and the whole CareQuest team has been everything we hoped it would be in a mission-aligned organization. We have really enjoyed getting to know the companies that you are about to see. I think you're in for a treat. You're going to see 5 companies who are all innovating in different aspects of oral health. You're going to learn a little bit about what they're doing, what their mission is, what is the business that they're creating, and what they have gained from this program over the last several months. So I'm looking forward to it. Hopefully you are too. And Maria, thank you again for this opportunity. And we look forward to continuing to build a real movement and real momentum around oral health innovation in the years ahead.
Thank you. It's been... What a great partner in crime with Matt and the team, and please do get to know them, and as the day progresses, and we break for cocktails and receptions afterwards. Speaking of cocktails, here's our agenda ahead of us. Those 3 foundational principles that guided us in designing Smile Health are the same foundational principles around which we have organized and curated the agenda for today. And with that in mind, I would like us to advance to the first part of our conversation. And I'd like to, I've enlisted the help of a handful of change agents and mission-driven visionaries to help me tell the story of what it means to build an organization, to build a practice, or to build a career that's driven by that mission first. And with that, I'd like to invite on stage Dr. Jonathan Levine, who is a world-renowned cosmetic dentist. He's an inventor, he's an entrepreneur, he's a change agent, he's a humanitarian, and more importantly, he's a dear friend of Smile and has been a very active mentor to Smile Health companies. With that, Dr. Jonathan Levine. All right, please join me and grab a seat.
Great to be here.
Great to have you. And I'm very excited that you and I get to share with just a handful of our closest friends what inspired the vision, as I said, you are a change agent and an early adopter to many of those principles around systemic health. And you have applied some of that systemic thinking to your dental practice in New York. And I wanted to just start with that. As a practicing dentist who sees patients still multiple days a week, how has that systemic thinking of integrated care changed the way you treat patients and you grow your practice?
Well, first, thank you so much. Such an honor and such a pleasure to bring like-minded folks together. You know, our practice, we're a multi-specialty dental practice. It's testing.
There you go.
Thank you.
That's better.
Here you go. Our practice in New York City is a multi-specialty dental practice. I'm a prosthodontist by training. We have periodontists, orthodontists, restorative dentists, ceramists. And it's always been the center of my universe. I've started a couple different companies. We have a foundation. But the practice is really where innovation and where thinking takes hold. We believe our vision, purpose, values, our vision of our practice is oral health is health care. We really believe that. And our purpose is very much, we believe that everyone deserves to have a healthy, beautiful smile. And it starts here into the practice. What it does is, number one, it creates a very high performance culture in our practice, where the assistants are international dentists. We are very much a digital workflow prosthodontic practice. But we believe that dentistry is the tip of the spear for diagnostics and for getting ahead of disease and taking a proactive approach, more of an oral wellness approach than reactive medicine. And we believe that 20% of the GDP for healthcare is unacceptable, and we can do better. And so we believe that in the hygiene room, where we really have an opportunity to educate our patients, we can take a lot of the new innovation and figure out, well, how do we bring the salivary diagnostic conversation and the new technology that's coming from the genomics into the dental practice. So we work with a fantastic company, Bristle Health, and we're able to introduce that to our patients so that they understand that the microbiome and the opposite of symbiosis is dysbiosis, and we could have a healthy mouth, and we pH test saliva, and we look at a standard of care of microbiome testing. It's just an example of some of the things we can do. We look at, in prosthodontic standpoint, airway aware is a new conversation in the pros community. But really, it can be much bigger because the dentist, the specialists, and the physicians need to work together. So technology is putting us together where it is so siloed, just what you're talking about. And we deeply believe that we can combine our efforts so nicely and get ahead of the disease process proactively by diagnosing early. So it's just about standard of having a CBCT diagnostics in your dental practice as a standard of testing and diagnosis to look at airway and to get ahead of that.
And this is such a rich topic, and I know that a handful of us would probably want to spend a whole afternoon with you talking about how exactly that happens. But in addition to that innovator mindset that you bring to your clinical practice, you are an active philanthropist and a humanist in many ways, and humanitarian. And so tell me a little bit about the humanitarian work you do. I know we have a video, but I'd like to skip that video. I'd like to hear it from you. And then I know that you don't do that work all by yourself.
Yeah.
There's an army of people helping you do that. I think you've brought one of those collaborators with you today, who happens to be a 4-time Grammy Award winner, an actor, an entrepreneur, an innovator, and a humanitarian just like yourself, Lenny Kravitz. And perhaps you could just, Lenny, and you could tell us about the origin of your humanitarian work that you do together, and a little bit about, hi Lenny.
Hello? Oh, you can see me.
We
Okay.
can see you now. Hi.
How are you?
We're doing great. Thank you for being very patient with us.
Not a problem.
We know that you are on your way from one concert venue to another.
Mm-hmm.
And Dr. Levine and I were just starting the conversation about your humanitarian work together. And tell us a little bit about what sparked that conversation and what happened on that fateful trip to your home in the Bahamas when Dr. Levine came in to visit you.
Well,
You know,
Go ahead, yeah.
the
Go ahead, Lenny.
oh, okay. I am very much interested in the medical world, in dentistry. I've been seeing Dr. Levine for some years, and we became friendly. And I invited him down to the Bahamas just to have a little vacation, and so we could get to know each other better. And I thought it was important to just talk to him about the state of the island. And I live in a very beautiful place with extremely beautiful people, but they don't have access to medical care, dental care, as they should. And I had just witnessed a friend of mine who I saw a few days prior to the doctor coming down, pouring black pepper into his tooth and then capping it with a matchbook cover that he'd rolled up to use as a stopper. And I asked him what he was doing, and he said he was in all of this pain, and that the black pepper was the only way that he knew to relieve the pain somewhat. So I was telling Jonathan about this, and I said, you should really see these people. They are having all kinds of problems, and he wasn't quite convinced with what I was telling him. So I said, let's just get in the car. We have one road on the island. We got in my Jeep. We drove down the road. The first person I saw, I stopped. And I said, hey, good afternoon. How's your mouth doing? They looked at me very strangely, of course. It's an odd question. I said, this gentleman sitting to my right is an amazing doctor. And he'd like to have a look at your mouth. Over the next hour and a half or so, we saw about 15 to 20 people, drove around the community. And what Dr. Levine found was quite shocking. The infections, people that had never brushed their teeth, a grown man that said he never owned a toothbrush, the pain that people were in. So he evaluated all this. We got back to my place, and we both organically just started talking about what we could do to help these people. And in that conversation, we came up with the idea of joining forces, starting this mission where we would bring down all of these amazing doctors. We purchased the gear we needed, the mobile units. We found a space, and we set up a clinic. And I guess a few months later, Doc, we had our first mission.
That's right.
In the month of December. And it was incredible. First of all, the amount of people that needed help, people that came from all over the island, people that actually came from other islands in the Bahamas nearby that had heard about it. And Dr. Levine and his team gave people their oral health back, gave them their smiles back, their dignity, their happiness. And I can say that what we all received was far more than what had been given. And we built this love story. And we've done 5. We got down the last 2 years due to COVID, but we're getting ready to do one in December. And it has been a beautiful part of our lives to be able to give people not only what they need, what they deserve. And it's been a very, very fulfilling part of my life to be working with Jonathan and his family, his wife, his boys. And it's brought us all together. And this is just the beginning. You know, as I said, we've been doing this for years now, but our dream is to set up a freestanding clinic that will provide medical and dental care to the people in these islands free of charge, so that they can, you know, have their health. And also, you know, if you remember, Doc, on one of the last missions, you brought down a doctor who was screening for cancer and different things, and we actually found somebody that had a problem that they never would have known about.
Yeah, dermatologist.
And we're able to move forward in you know, that process. So that is our dream, and we're on our way. But as Dr. Levine says, he's a dentist who thinks he's a rock star who thinks he's dead. So we work very well together.
Thank you. I'm very humbled, and you could hear probably from the response of the audience. You're speaking to a very motivated group of decision makers who are really sharing that same vision that you have been able, you and the Let Love Rule Foundation and the Glow Good Foundation have really started to put the elements for in Eleuthera. A lot of us, many of us here in this room are trying to do the same thing on a much larger scale and here in the US. And so I wanted to get probably a conversation, a question between the two of you. How has your work in Eleuthera changed your work here in the US? And how has your humanitarian work influenced your career? And again, Lenny, you're a co-founder of a oral health company. You're the chief creative officer twice. And so how has your humanitarian work and your mission-driven existence has influenced your choices as an entrepreneur and a businessman?
You want to start, Doc, or shall I?
You know, you've been doing a lot of talking, so I'm going to take that one. No, you know, I was so fortunate when Lenny cornered me in the practice, came back from Rwanda on our first mission, and he said, you got to help my people. And we started, and we did start very organically. Multiple levels of impact of doing something like this. First of all, it's incredibly inspiring to your team. So we talked just a moment about culture and doing things where you develop this deep trust. Of all the things that I've done kind of in my career, and everything kind of connects, nothing brings us more happiness, myself and the team, to help these people. And it's deep. And you come back to the practice and you're completely charged up. Mm-hmm. So I think that we have this opportunity, you know, the microcosm of Eleuthera, to help the profession say, let's do this. Let's inspire each other to do things like this, because the dental profession, let's just say what it is. We're oral physicians. And for some reason, well, we know the reason, but in the 1840s, but it's separate. Well, it's time to come together, and it is time for change. And so going to Eleuthera, where people don't have access to care, where they have a modern diet, where they're eating, you know, sugary foods and sodas and don't really know what a toothbrush is, and they think that walking around in pain is normal. That's something that when you start changing it, going into the schools, Michelle Henshaw at BU Goldman School goes into the schools now, where we're taking people and we're diagnosing, and we come down with a full team. We come down with the hygienists, with the prosthodontists, the oral surgeons, and people walk in pain, and they're walking out with hopefully our goal is for them to have this beautiful smile and give them their dignity back and give them back their soul. And when you don't have it, you really appreciate it. So I do think there's a lot of tremendous learnings that we could have because of this partnership that developed between Let Love Rule and Glow Good Foundation. And we believe we're just getting started. We really are just getting started. COVID put a little bit of a 2-year hold. We're going back in December. Because of Henry Schein Cares, we have more of a freestanding clinic that we're building with real equipment in that building. And having partners like CareQuest, who's hopefully going to be supporting some grants on what we want to study, because we believe that having an impact in the schools and screening and education, they bring that home to their parents. There's a conversation. Where's your toothbrush? How many times a day you're brushing? They come to the clinic. They get those tools. They get educated. And then all of a sudden, we have an incredible study in a small group that is scalable. That is really scalable. So I think there's tremendous learnings from something that we started together because we really, at the end of the day, just wanted to help these fine people.
That's right. And Lenny, you say charity starts at home. That's why you started with, you started with.
Well, I would have never dreamed that this would be something that I would be doing. And I think, when you think about doing things and trying to help folks, a lot of times you see people having these sort of grand ideas about going somewhere foreign and finding these people that need help, when in fact there are people that need help right in your backyard.
Right.
And sometimes that gets overlooked because we're trying to think of this grandiose idea, and maybe we take home for granted a bit, But that is something that my mother always taught me as a child. She said, charity begins at home. And this was truly an exercise in that. So it kind of found us, As I said, I would never come up with that. If you said, what would you like to do to give back? And this would not have been on the list, I wouldn't have thought of it in that way. But the fact that I live there and spend so much of my time there, and I was just witnessing these people, it was like, well, we have this right here. And by fate, I met Jonathan and we became close, and we both have a very similar heart. And, it's really stunning what gets done there. He's making it sound, we're going to have real equipment later. These guys are in there doing the work that he does on Fifth Avenue, right in the bush there. From cleanings to fillings to extractions, root canals, false teeth being made on premises, people getting teeth in their mouths,
Wow.
2 days later. And then you hear the stories, people that haven't smiled in 7 years, have been afraid to communicate, covering their mouths, not expressing themselves, and not being a whole human being due to the fact that they're having these problems with their oral health. And the tears of joy, the gratitude, the respect, and the work that is being done with the right attitude. A woman stopped me once and said, I feel as though I paid top dollar for the work I got. Meaning nobody came in with the savior attitude. We're here to help these poor people. No, the team does it with such love in their hearts and dignity and respect for the people that the woman said she felt she paid top dollar. Like she'd gone to New York to Fifth Avenue and paid that money to get the work. And
That's impressive.
it's just wonderful, and I'm grateful that this found me.
Well, I haven't
Likewise.
heard Jonathan play, but you definitely sound like a dentist.
He knows his stuff.
But you do know your stuff,
He
and
does.
I'm very much hoping that your friend who was using black pepper now has a beautiful smile and probably uses something else or has somebody to call when he's in trouble. And So incredibly grateful for so many of the insights that you have shared. And I promise you this, a lot of the insights you just touched on, we share and we actively work to advance. And even for the rest of the day, you're not here with us today, but you will hear a lot of the conversations for the rest of the day would be, how do we deliver care to the communities that need it the most, yet who are the hardest to reach and who have most barriers to access? And how do we innovate in those communities? Because many times the assumption is that you need a resource-rich community to do innovative things, when in reality, we've seen it that when you're resource constrained, that's where the creative problem solving starts to happen.
That's right.
And we're seeing a lot of that cutting edge integrated delivery models that we talk about in the US, you are deploying, Lenny mentioned, in the bushes with very little infrastructure. So I'm very grateful for what you have shared. I'm very grateful for the inspiration and the time that you took. For those of you guys in the audience, Lenny and his team had to literally stop the bus as they were going from one rock concert to another to speak with us today. And we're incredibly grateful for all you do and for the time that you spent with us today. Thank you.
Thank you for your time.
Thank you, Lenny.
Boy, was that
That's, it's just the emotional conversation
yeah.
of that side of the equation of what we do in this profession. And what CareQuest and this conference is really bringing to light is that the profession is getting reinvented and change is coming. And this is just this opportunity that we had that's just organically growing. There's so many great organizations and not-for-profits doing this kind of work. And it's really powerful. It truly is powerful, and it's something that hopefully in the future with CareQuest Innovation Partners really to scale it up.
That's right. And on that very important point, I'd like to introduce Dr. Mike Monopoly, who leads grant strategy for the CareQuest Institute for Oral Health. And I'd like for him to join us for the conversation and perhaps take us through welcome. First of all, welcome, Mike. It was great to have you. Mike, first of all, I'm so grateful that you're here and impressed, because this was a hard act to follow. And when we were designing the program, I really thought hard, what is the best way to continue the conversation after Lenny? And it really, I couldn't think of any other better way to think about how we scale some of that deeply emotional, deeply relevant, personal motivation about doing what we do. And so maybe I'd like to start with kind of a question for those folks in the audience who are not familiar with our grants program on the CareQuest Institute for Oral Health. Tell us a little bit about how the grants program is enabling some of the changes that Lenny talked about at a local community level and some of the work you do.
Sure, thank you. Can everyone hear me?
Yes, we can.
Great, thanks. So yeah, I'd like to start by just saying that what philanthropy is. So I think CareQuest Institute has multiple capacities and ways that we can support growth going forward, but I think I want to talk specifically about two of those. One is our grant-making ability and strategy, and the other is our advocacy ability and strategy. I think there are lots of things that philanthropy can support, but I think three of the most important and most relevant to the conversation we're having today is, one, to be a convener, and to be a convener in a way that brings people to the table and looks clearly at what are the most important aspects of bringing people to the table, who's at the table, and what's the conversation, and how we incorporate the input of people that are most impacted by what we're talking about, so that we do things with people, not for people, or not in a way that presumes that we know better than what the community needs and how we can move forward. The other is, as I was saying, the capacity to be an advocate. So in terms of advocacy, to be able to look at what are the barriers of access to equitable and integrated and affordable care, but also what are ways that we can help to support that going forward. And how can we, as advocates, make sure that there's a regulatory and a resource environment that supports the community and moves things forward, so that we have that ability to empower and have a community that has the best resources possible. And that's what we've been talking about for the afternoon up till now. And then the other is to do pilots and tests and to be in the community to help to really see what is happening and how what we're talking about in cooperation with the community moves things forward. I think that when we think about innovation, I think what we really want to do is look at innovation for prevention. How can we make sure that people have access to prevention in a meaningful way? Because when you think about oral disease, it's really a chronic disease, and most of the way that you work with and impact that chronic disease is what happens at home and what happens when you're actually not in a clinician relationship, but really what's happening at home and in the community that you're a part of. I think that
great. And a lot of the things that you touched on is, again, we're bringing multiple tools in service of bringing resources to local communities and capabilities. Tell us a little bit in your experience, and I'd love to hear Dr. Levine's point of view here as well. When it comes to innovation, and we touched a little bit on it with Lenny, do we need to wait for some of those communities to be a little bit more developed before we start bringing some of the cutting edge technologies there? Some of us would be proponents of the idea that we could use technology innovations to, frankly, leapfrog some of those communities that are dentist deserts, that don't have access to healthy nutrition or access to overall medical care, and try to design or deliver care that is that next generation care, more preventative, minimally invasive, more integrated. And so tell us a little bit about, in your experience, have you seen success stories where we're able to do that? We're able to use those innovative tools and solutions to advance a local community forward and maybe even leapfrog some of the other communities who are not innovating from scratch, if you will.
I think it's definitely a back and forth process that, in fact, what we try to do in our grant making strategy is to make the barrier to good ideas as low as possible, so that an initial idea can come to us, and we use a relational type of grant making. And Trinae Simpson, our director of grants, is in the audience. She can wave.
Please make sure you say hi to her during reception hour today. Yeah,
for sure. And that that we look at those ideas, vet those ideas, work with members of the community, and work with our team and our staff to develop those ideas in a way that is going to be really applicable to the community. So I think that we've seen a number of communities that don't really have the resources to immediately write really strong proposals, don't have the resources to really bring together the kind of resources that they need, but that we can work together to develop that capacity.
And Dr. Levine, how has the ability to, in a small community like Eleuthera in the Bahamas, how has the ability to perhaps pick up the phone and get the Minister of Health and the Minister of Education and the Minister of Infrastructure all in the same room the same day, how has that helped you deliver an integrated care model there with all the tools that technology and innovation allows you?
Because we started organically, we just started year 1, year 2, year 3, and it developed a bit of a crescendo of activities and energies. Once we went into the school, because there's really two very distinct groups in an island like Eleuthera, right? You have the children in the schools and you have the adults. And by impacting both groups, by going into the schools, and very fortunate to have the public health group of BU under Michelle Henshaw, going into the schools, as she went to 1 school, 2 schools, 3 schools, and just with brushing programs and screenings and fluoride, and then treating the children and educating them. I touched on it before, they have an impact in their home, in the family. Now we're treating the adults, and you're dealing with multiple missing teeth and all kinds of occlusal issues and walking around in pain and abscesses and, literally life-threatening possibilities for these people. As we attack that and go after it and get them also on a preventive mindset, you're moving a whole community in a very positive direction. So I think there's a tremendous learning there, that in this kind of microcosm of an island where you had the poor side of Eleuthera, and this is north of Eleuthera, in a town called Gregorytown, and Lenny lives very close to these people and very close with them. You could really study that. And so the hope is to study it and to understand it, but also to look at new innovation, whether it's microbiome testing, whether it's airway, whether it's inflammatory markers that we can detect, and before and after treatment, we could come out with this outcome assessment of impact, of what kind of impact we could have by these actions and these activities. And that's why I do think it's going to be a wonderful opportunity as we continue year after year, and now multiple times a year, now that we have more of a freestanding clinic, to help these people, but also to translate that information for a much bigger strategy.
And one last question, connecting to the topic that we started with. Your next mission is very bold in the sense that you are planning to deploy and screen not only for dental issues, but also issues around sleep apnea, issues around potentially early cancer diagnosis or A1B testing. So tell us more about how you plan to evolve the mission and make it more, and really take advantage to have a longitudinal view of the data and the impact you're having on the clinical outcomes there.
Yeah, so as things are developing, and we've had for the last about 4 or 5 years, 5 nurse practitioners, and we're looking at developing diagnostics that is fairly straightforward, whether it's salivary diagnostics, whether it's sleep quizzes, through Sleep Architects, a wonderful company who's here today to develop this platform, through a telemedicine, teledentistry model. We're able to get baseline for the groups, whether it's the children's group or the adult group, and look at the impact of change and improving their oral health on these types of things, whether you're looking at A1C, whether you're looking at inflammatory markers like a C-reactive protein. And we can get that baseline and then see impact and change and look at it longitudinally, which is going to allow us to create the conclusions of what actions we take will have what kind of impact. And to me, that that could be very interesting, because that will be more of a scalable model that we could bring to other places. Yeah.
Mike, any last comments? And what is your hope or potential for a program like this, and maybe learnings here in the U.S.?
Mm-hmm. So as I said, we have a concept that we're starting to talk about in terms of the work that Dr. Levine has been discussing. And I think the real opportunity in the schools for us is to use that environment and add in some innovations around minimally invasive care and the ways that we can bring prevention to the schools in a meaningful way, and then follow the outcomes. And a second part of it is to develop a system where we can monitor health status. It's one of the core public health functions is surveillance. With the word surveillance kind of got a negative connotation over the past few years, but definitely a way that we can monitor everyone's health and see how it's moving forward, and then also to look at diabetes and other adult issues that we can support and have a fully integrated plan between children and parents.
Well, that's quite an ambitious agenda, and I know that both you and Dr. Levine are very busy on that front, and really continuing that ethos of mission-driven work in every aspect of our lives. And so I'm very grateful for your work, for the time that you have spent with us. And with that, I would invite us to to continue the conversation after the program, during our reception later today. And thank you again for being part of this conversation.
Thank you.
Thank you. It was great. All right. Well, as I mentioned earlier today, for those of you who may have additional questions or
eager to get involved either in the work of the Glow Good Foundation, Let Love Rule, or the work that our impressive grant team is doing, please reach out to them individually, and we will have more information for you after the program today. With that in mind, I'd love to advance the discussion to the second pillar and key characteristic of Smile Health, which is the way we have designed the program with our impact partners. We've designed the program for impact, and I would love to introduce the partner in crime that has been developing this with me for the last 15 weeks, and frankly, over now 12 months of working together. I could not have asked for a better partner and a thought partner with me in this journey. Kirill Zeidenman, Vice President of Innovation, CareQuest Innovation Partners, will lead us through that next section of our program and really peeling the layers of design choices that we made that made Smile Health such an important part of these solutions go-to-market strategy. So with that, Kirill, please join me.
Well, thank you, Maria. It's a real pleasure to be here speaking with you today. As we said, we designed and created Smile Health with health access, equity, and integration in mind. And the program inception motivation is really rooted in that mission. With that in mind, as we started to design the program, we wanted to design it for impact. And we had a number of design choices to make. How many startups do we include in the program? Who do we invite to be in the program to help these startups? And so all of these design choices were really thoughtful. They took a lot of time, and everybody here, from the startup community to the impact part of community to the scale part of community, is really what makes this program special. This is why we paired each one of the startups with one or several impact and scale partners to be able to propel them forward. Leading organizations from the oral health industry, from dental, and importantly, medical insurance companies, care providers, academia, venture capital, all worked with these startups continuously and directly for over 12 weeks to look at things such as product market fit, to size the market, to think about the end user needs, to think about manufacturing costs, and to think about the real issues of reimbursement. And so in working with them, we also made available a data sandbox of longitudinal market and industry data so that the insights that came back could be measurable, specific, and meaningful to drive business decisions. And so this is what really differentiates and what is the secret sauce of Smile Health. It's the ability to validate the startup. It's the ability to seed the investment of the partner, get access to the first customer, and ultimately shine a light on a pathway to scale. Or, as you will hear when the startups come up, really to allow these partners and these startups to co-create the future. I'm incredibly grateful and very humbled and want to say thank you to all of our Smile Health impact partners, to Smile Health scale partners who have been so involved in this program. And with that, I would very much like to invite a few of them onto the stage with me now to advance the conversation so you could hear from them. So I will just take a seat and one by one invite three of our impact and scale partners. First, I'd like to invite Claire Levesque, who is Chief Medical Officer for commercial products at Point 32 Health. And for those of you who don't know Point 32 Health, it is the parent company of Harvard Pilgrim Healthcare and Tufts Health Plan. And Claire is responsible for clinical leadership, medical management, and medical cost control. And she works with providers to develop member-centric programs that really meet complex needs that focus on health equity. Welcome, Claire. Second, I'd like to invite Todd Cruz, who is Executive Vice President at DentaQuest and the President of Advantage Dental, DentaQuest Dental ACO and Retail Health Operation, and a wonderful partner to us, not only in Smile Health, but outside of Smile Health in terms of advancing minimally invasive care. Todd has spent 25 years in dental and medical programs and has served in roles such as Chief Administrative Officer and Deputy of Legislative Affairs with Tennessee Governor and Chief Development Officer for a multi-state Medicaid-focused dental service organization. Welcome, Todd.
Thanks, Carol.
And finally, I'd love to invite a dear partner who's been so really central in helping us with Smile Health, Dr. Jeremy Krell, who is a general dentist and managing partner at Revere Partners, which is the first independent venture capital fund focused on oral health, which is a really important distinction, especially given some of the data we've been talking about today. So welcome all. I am so grateful to have you here and to be able to talk to our audience about some of the reasons why you have chosen to partner with Smile Health and some of the things that you experienced and your viewpoints on these companies that we'll hear about shortly. So I'd love to start with a question to Claire, if I may, and then to Todd. In your opinion, why is validating startups so significant, especially at the early stage that they're in? Claire.
Thank you for that question. And you know, for me, a lot of this is really about how do we make sure innovation is practical and making sure that we're going to be able to deliver it to folks quickly. Sometimes innovation is about the fancy device or the fancy technique, but it has to be able to be integrated back into the healthcare system as a whole. And one of the difficulties we have, of course, is we have medical insurance over here, and we've got dental insurance over here, and we've got all these things that don't work well. And so, you know, I'm trying to push people to get good dental health, but if they come to me and say, could you recommend a dentist? I have to say, I don't credential dentists. They don't contract with me. And so that's not all happening. So how do we move these things closer together? We worked with Sleep Architects, which is for sleep apnea. And sleep apnea can be treated in two ways. One is with a machine that gives you positive air pressure during the night, something that some people do well with and some people cannot tolerate at all, or an oral device that is obviously developed by a dentist. And these two things are in very different parts of the healthcare system. So we have to figure out very practical ways to bring this together if we're going to get this to work. And I'll give you an example outside of the dental sphere about how sometimes early in an innovation, somebody can have an idea that's just not going to work at all. So somebody came to me earlier this week and said, we've got a great program and it's going to help you with when people are thinking of getting pregnant, how to make sure they're as healthy as possible. And I said, oh, terrific. You know, I love this idea. Maternity is a big focus, particularly on the health equity and disparities. That would be terrific. And so then she said to me, and we want you to tell us who's thinking about getting pregnant. And I said, I'm a health insurance, you know, and I can tell you after they actually went in the hospital for the labor and delivery, I don't have any way of telling you that. And so right there was a fundamental problem with this great innovation. And so I think when we do these kind of incubators, we can identify those issues and then work together to figure out how we can get past them, as opposed to going way down a path and then finding out that something actually doesn't work at all in the healthcare system that we have.
Wonderful. I love that example from the medical side. And to me, I just want to reflect on the fact that we're having a lot of medical conversations in an oral health space, which I think is really phenomenal and where we want to go. Having said that, dental is important. Todd, in your world, you have been looking at innovations, you have been piloting innovations. However, how does actually being able to validate an early stage startup helpful for the startup and to you?
Sure. Again, great question. And I think you had the best word, which is practical, right? From our view, it's the end user, right? How practical is it for the provider? How practical is it for the payer? And more so the patient. So that's extremely important when you're trying to, get workflows done and make sure that the innovation is actually going to deliver what it's supposed to deliver. We worked with ORSDX, and I think it's got a lot of promise, and the minimally invasive approach is always something that patients are into. I also think from our view, it's also the fast fail, right? You've got to get out there. You've got to try it. If it works, great. If it's not, can it be augmented? If it can be augmented, how can we help play a role in that so that it actually can come to fruition? There's nothing worse than something just, and again, I'm the non-doctor up here, so if it's gumming up the business system, then it's got a problem. So you want to make sure that it is accretive to whatever you're trying to do. So that's why being in there early is extremely important.
Thank you. And Jeremy, I'd love to bring you into the conversation. So you are a physician, obviously. When you look at these dental startups, having experience in a clinical setting helps you. But as an investor, right, why is it important to have validation for these startups, and how does validation help de-risk them for you as an investor?
Yeah, thanks. And I think it's a careful balance, because we have a lot of early stage startups that are in this space where they don't necessarily have an objective metric you can guide them with, right, or guide your team with to make a decision on. It leaves our team struggling, as I've struggled with many great people in this room who are decision makers at their respective organizations, thinking through these early health innovations. We're looking at their team. Do we like the team? Do we think their backgrounds mesh well with what they're trying to do? Do we think they can do it effectively, right? We look at the market opportunity. What do we know about it? Is it big enough? Are they targeting it the right way, right? We look at the product, the service. How far along is it? How well developed is it? But there's a lot of subjective in what I'm talking about here, right? And it's really hard to only have subjective measures, and that is often the world we find when we come to meet an early stage oral health startup. So to see an early stage oral health startup that actually has some real validation, right? Typically in there, and there could be some subjective too, but typically there's something that's really measurable there, right? Did they get feedback from users, right? Which is also really important. And how did the team react to that feedback? Did they incorporate that feedback? Were they coachable in doing it? Right? Because startups, you're getting feedback every day. Right? Were they able to sort the noise out and find what was really relevant and act on it? In addition, how about users? How many of them? How did they use it more? Did they want to use it more? Why not? Right? Dollars in revenue. Right? There's all sorts of different metrics that we can look at there, and that really helps us to guides our decision. It's not always about, and I want to kind of point out one myth before passing the mic back, which is, startups are often obsessed with big numbers. It's not necessarily big numbers, right, that is required. It's showing improvement over time, right? It's that when you're on an early, sports league as a kid, right, and you're playing Little League in your hometown, it's that award. I don't know if they still do this or if this is still PC anymore, but they used to give an award for most improved, right?
They still do that.
On the team. And that award is maybe the most relevant to the decision making here. It's not the one that necessarily scored the biggest revenue last month, right? It's really the one that that improved over time. And to some of the previous points that are made, we often also find ourselves in cases where the innovation is not viable. It may be the best idea since sliced bread, but it is not viable in the system that we have, and that makes it difficult to move forward. So we need to see that come out in validation sometimes.
Thank you for that point. But we're just having a conversation with one of the startups about the value of getting the first customer. Thank you. So the theme of our panel is designing for impact. So let's talk about that. Tell us about the validation studies a little bit more. You mentioned the companies. What did you learn? Claire, I'd love to start with you.
Yeah, so certainly what we learned, I talked a little bit about sleep apnea. So sleep apnea typically is diagnosed by either a neurologist or a pulmonary doctor, and through a sleep study, and then treatment is prescribed. And the treatment that the pulmonary doctor and the neurologist know about are these machines, these CPAP machines that give you continuous pressure airway, keeps the airway open at night. And these are very tricky things to work with. There's a mask over your face. It's very annoying for most individuals. And so some people figure out how to get it to work. They do well. Other people don't. And when they don't, they throw the machine out, or it sits on their nightstand forever collecting dust, and they don't go on to other treatment. And for some of those folks, a dental appliance is the treatment that they could use. But the pulmonary doc is not necessarily well tied into the dentist. The dentist isn't tied in well. So with sleep architects, we're talking about how can we integrate that better to make sure if a dental appliance is the right way to treat somebody, that they would actually have access to it. and that through this we'd be able to make sure that they understood that these things are actually paid for through medical and dental insurance, and that you can actually get this appliance. So unfortunately, sleep apnea is underdiagnosed, undertreated, and many people suffer from it. And unfortunately, sleep apnea can lead to cardiac problems, it can lead to strokes, it can lead to all these problems. And so we want to make sure that we're treating these well. Just to mention, I'm a neurologist, so I saw a lot of people with sleep apnea. I saw the struggles that they went through. And so I know we need to give people, it's kind of like you wouldn't say, oh, for your hypertension, we're going to try the first drug, and if it doesn't work, oh, well, just live with your hypertension. We would say, here's the other medicines you can take, here's the other approaches. So here's one of those places where that integration across the medical and the dental is critically important in making sure that, we can, if somebody responds to one treatment, great, let's support them around that. But if not, make sure that other treatments are also available.
Wonderful. Yeah, it really expands access to care.
Right.
And so Todd, to your study, how did your work touch on access, other things, and what did you learn about it?
Sure. So we worked with ORSDX, right? So, a minimally invasive approach to diagnosing oral cancer through saliva is fantastic. If you think about, 400,000, I think, people a year are diagnosed with oral cancer, and it has a very high morbidity rate if it's not caught. So if you can get to it early, and you can get to it through the minimally invasive approach, which is easier on the patient, of course, we learned that the doctors would love to have it. So I think that's step one. I think step two is that it needs to be billable, right? You need to be able to get paid for it. I mean, a non-doctor comes down to the economics. You've got to be able to get out there and put it into the market. So I think those two things were probably the two biggest things that we came away with. I actually learned that, and this is, I'm sure, most of the clinicians knew this, but a lot of us on staff didn't know this, that, early diagnosing oral cancer, you cut that morbidity rate dramatically. I mean, you go from like 80% to 25%. That's a huge jump. I mean, and it's really simple. So I thought it was a really good opportunity with a lot of good validation. Learned we could pay for it as well. So again, that's the other upside.
And I'd love to jump in on that oral cancer issue. So another struggle I have is the HPV vaccine. So this is the vaccine that individuals should get really preteen, so let's say 11 or 12 years old, and to prevent cancers down the road, including oral cancers. And we have an awful time convincing folks to really move forward with that. We actually did have a project with DentaQuest a few years ago, and one of the things we were trying to figure out was, could dentists just give the vaccine? If you can do all these things in somebody's mouth with all sorts of, equipment, one would think that somebody in the office could do a vaccine. Now, again, how healthcare is so fragmented, the Massachusetts Medical Society said, get lost with that idea, and the legislators said, we're not changing scope of practice. So these are the things that we put in the way as barriers that don't allow us to really give good care. I would say, orthodontists giving the vaccine would be fabulous because so many kids in middle school age are going for their braces, and just give them the vaccine. But we don't work that way in this country, and we need to do better with that.
Agreed.
So Jeremy, again, now that you've been very involved with the program, watching it, seeing how these startups progress, as you see Sleep Architects or SDX, the three other startups that we have, how is this changing the way that you're thinking about these spaces that they're in, issues around access, equity, integration, and how is it changing sort of your perspective and approach as an investor?
Yeah, I want to encourage everybody in the room to think about that space underneath your sink, right? And when you open up the cabinet, it's dark and it's dusty and there's cobwebs in there, and that's where all the dental innovations that never got off the shelf live, right? And
I did not know that you visited my home.
That's where they are. They're in my home. I know they're in Carol's home. They're in a lot of our homes. Because they were missing some critical piece to get over the activation energy, right? Kind of nerdy chemistry joke there, right? They just couldn't make it up that, it would have maybe flown had they made it over that hump, but they couldn't make it over the hump, right? And they couldn't do that because they were missing some piece of the patient, the payer, the provider, or the experience sort of diamond, right? Something wasn't there. Both of these two startups, ORSDX, Sleep Architects, they work across, I hear, two trends here. One is access to care, and the other is dental medical integration, which are both such critical pieces, right? And we do need to do, to the previous points, a much better job with that. But it is great for us, the investor, to really hear from real partners, what do they think about it, right? First of all, the market validation, right? And the need for it. How many millions of Americans struggle with, obstructive sleep apnea? How many, the improvements that can be made from 80 to 25%, right? On the oral cancer side. These are real things that, we might postulate, right? We might theorize and model and, research with a lot of our partners. But a real part of our diligence process is going and speaking with, such scale and impact partners in the field and determining, is there really something there? And not only is it there, but is there an appetite to act on it, right? And a real pathway to do that without, major blocks, that would otherwise, cause the startup to be obsolete. So it's incredibly important to have this kind of support and this kind of intelligence around the diligence process for us, the investment process, and ultimately the scale of the startup.
Yeah, well, on that note, I actually couldn't think of a better way to wrap up this panel than to actually think about this appetite to scale and to act, and having these, two wonderful companies on the stage with us as a validation of interest and ability to sort of partner with startups. And with that, I would love to thank all of you. It is, again, an honor and a pleasure to be on the stage with all three of you. And I'd love to begin to transition us to the next part of the program, which is where we actually hear from the startups themselves, who will talk about how they co-created the future with you. So thank you so much.
Thank you. Thank you.
There we go. Thank you. Wow. What a lineup of speakers and powerhouses when it comes to our ability. Oh, well, there you go. We are co-creating definitely this stage and shaping things and transforming things in real time. And so thank you, Kirill, and thank you for all your support to all our impact partners, not only to the two companies, to DentaQuest and Point32 Health that you saw today here on stage, but we have over 18 different impact partners and a number of scale partners who are the investors who have come in and helped us really think critically, but also creatively about scaling some of these solutions, transforming healthcare. With that in mind, I'd love to, without further ado, really dig into the next conversation, next part of our agenda, where we will hear very brief pitches from the 5 startups that are part of our 2022 cohort. And I would love to invite you to think about the future that we are all creating when solutions like these would be adopted at scale. And again, think back to that original question that we started with today, your last visit to the doctor, and how that visit might change if we're successful with scaling some of these transformative solutions. With that in mind, I would invite before I invite the first startup, the first startup is actually an international company where they're based out of New Zealand. They were here with us in the US. They spent a handful of days with us at Stakeholder Day, which was an opportunity for us to dig deeper into their solution and the business opportunity there. However, today, they were not able to make the trip. And so with that in mind, we will hear from them virtually. You will see their pitch and this opportunity for the solution. And then again, we could connect with them after the program. With that in mind, I'll leave you in the hands of Dr. Choi and Snow-Capped Crowns.
Our first presenter is coming to us from Dunedin, New Zealand. Please welcome Joanne Choi, founder of Snow-Capped Crowns, a non-invasive and equitable novel crown from the Sir John Walsh Research Institute at the University of Otago.
What if every child around the world could get their teeth decay treated with no drilling, no injection, less pain, with nicer looking crowns that will bring back their smiles? Hi, I'm Joanne Choi from the University of Otago, Faculty of Dentistry, New Zealand. I'm the lead researcher and a founder for snow-capped crowns, an exciting solution to treat dental caries in children. I'm a full-time academic and an active researcher passionate about developing innovative products to change the dental industry. Dental anxiety is a big problem in dentistry. While receiving dental treatment, children struggle with dental anxiety, and this can set up a child for lifelong dental trouble. Number one reason why people develop dental anxiety is with the drilling and injection during dental caries treatment, especially when they are young. Unfortunately, dental caries is very common. In fact, it's one of the most chronic childhood disease affecting more than 530 million children globally. And there is a greater burden of disease among poorer children and ethnic minorities. Traditionally, the dental caries are treated by drilling the tooth with injection, which creates a huge dental anxiety in children. Fillings can be amalgam or resin, but these materials have limited lifetime, meaning that children need to go through this painful procedure number of times while they are growing up. An alternative dental caries treatment is the hole technique. It's known as the no drill, no pain procedure, utilizing a preformed metal crown that can be capped. By capping, the bacteria inside is sealed and stop getting oxygen and sugar, and dental caries stops and stays in the crown before the baby tooth comes out. This is a scientifically proven, widely used dental caries treatment in the UK, US, New Zealand, Australia, and Europe. As the whole technique doesn't require drilling and injection, the treatment can be delivered not just by the dentist, but also done by dental hygienists or dental therapists. Another benefit of the preformed crown is that they can be used for both the hole technique or the traditional drilling technique. So basically, a clinician can buy one product that can be used for two different methods. However, these metal crowns have two major problems. First one is the aesthetics. When multiple crowns are placed in closer to the front teeth, it looks terrible in the kid's mouth. Number two is the design and difficulty of crown placement in the clinic. The preformed metal crowns come in different sizes and shapes, but often they are hard to cap over the tooth. And these preformed metal crowns don't fit every child because the crowns have very European-centric design. But our new white preformed crowns, the snow-capped crowns, can solve all these problems. Firstly, our snow-capped crowns are white, aesthetically pleasing, and our crowns will have unique design based on scientific evidence. The crowns are made out of a special polymer blend that has the strength and flexibility. My research team has validated the proof of concept and conducted in vitro capping trial to test the acceptability of our crowns by the clinicians. We are currently preparing a clinical trial from next year and optimizing the polymer blend to have the best properties. To improve the design of the crowns that will fit children with different ethnicities, we've been digitally scanning 200 children at the dental school with 4 groups: European Maori, who are the indigenous population in New Zealand, Pacific Islanders, and others, including other ethnicities. There's a wide range of preformed crowns available on the market, mainly the metal preformed crown, zirconia ceramic crowns. The zirconia crowns are white preformed crowns, but they can't be used for the whole technique, whereas our new white crowns can be used for both, and it's going to be aesthetic and going to be easy for the clinicians to use. I'm very grateful that I got into the Smile Health program. And as part of the Smile Health validation study, I worked with my impact partner, Glidewell, and we set up the validation hypothesis as the University of Otago's snow-capped crown is a more economical alternative in cost of time and materials compared to the existing solutions and financial benefit to both patients and dentists. From the validation study, we identified that the pediatric preformed crown market in the US can be split into two: commercial and public insurance, such as Medicaid. The total market consists of 5.5 million preformed crowns placed per year, which makes $82.5 million market. And that's the current market, but there are a couple of reasons why the market will be bigger for our snow-capped crowns. Firstly, our snow-capped crowns will be more profitable solution for dentists and providers because it's already well known in the literature that drilling filled into caries treatment takes longer, whereas the whole technique takes less time, meaning that a clinician can see more patients per day using the whole technique. Another reason why the market will be bigger is that our crowns will be more accessible, as crowns will have a better fit for children with different ethnicities. The digital scans of 200 New Zealand children that we've been collecting, my impact partner Glidewell helped to analyze the scans by giving the distribution of tooth sizes. This was really helpful because currently the metal crowns come in 6 different sizes for molars as an example, but the biggest crown's width only goes up to 9 millimeters. But if I look at the distribution of the average width of the molar teeth of 200 New Zealand children, 28% of children have molars width longer than 9 millimeters. And out of these 28% of children, 90% of them were non-European children. So this validated the need for a better crown design in different sizes and how our snow-capped crowns will be capturing a wider group of children, making it more equitable. So here's our future plans. My team will start a clinical trial in New Zealand from next year. The follow-ups and results from the clinical trial will help us optimize any aspects of the crown or the use of it, which we can build MVP. From 2024, we will be looking into FDA approval process and get things ready for sales, and we go from there. Thank you for listening, and I want to end the talk by asking everyone to join our mission to make dental caries treatment nicer, better, more accessible, and affordable to everybody.
Please welcome to the stage from Calgary, Canada, Equitable, a state-of-the-art AI-driven clinical decision support tool. Welcome co-founder and CEO, Dr. Amrish Khanna.
Just gonna ask for assistance on the clicker. Well, hello everybody. A wonderful day. My name is Dr. Amrish Khanna, and the founder and CEO of ORQ AI. I'm very excited to be here today to tell you about our grand vision of changing and bringing a new model of care to dentistry that will one day allow us to have ORQ running in clinics all over the world. We're driving a new model of precision care utilizing AI and machine learning technology to make customized care to the needs of every patient. Everyone has heard a story about a bad dentist, one who's recommended or performed a certain treatment on a patient, and another dentist has told that patient something completely different. Dentists are busy and stressed, and amongst a ton of daily distractions, managing patient care effectively and running successful dental practices, they don't need this erosion of trust to come in the way of them having their patient's best interests at heart. Misdiagnoses can be life-changing. For example, a child being labeled with ADHD when maybe had an underlying sleep disorder and that could have been screened at a dental practice. Or one dentist sees a patient and tells them, hey, we're gonna watch that cracked tooth. And 6 months later, another dentist is telling that patient, now you need a painful extraction and a costly dental implant. I'm a dentist practicing for over 15 years, and I see this problem every day within my clinic, with struggles with patients wanting to see me over an associate, all because of these issues. How am I able to scale and grow my practice to serve more patients if they don't want to see another dentist in their practice, somebody who I truly trust? This inconsistency is leading to missed and undiagnosed treatment opportunities being left on the table. Patients need to be able to trust that all dentists see them with the same knowledge and ability to recognize all opportunities of care so that they're motivated to proceed with treatment. Today, this practitioner inconsistency can cost a business up to $4,000 a day in a lost patient care opportunity per dentist. Don't patients deserve a holistic and integrative model of care that removes the bias of dental providers towards optimal patient outcomes, regardless of the doctor's age, where they trained, what continuing education they did, or how they subjectively perceive what they think is best for their patient? We need a solution that can guide prevention and early intervention to avoid costly, more expensive treatment later, something that's better for patients and supportive of the model for payers. Attempts today at solving this are done by spending tons of money on continuing education and mentorship that is still a slow, long process, still yielding inconsistent results. We've created a better way, to bring a consistent process compliant with best ethical clinical practices through patient risk modeling, predictions, and identifying risk progression so that we can guide early intervention for much needed areas of care for more effective disease management. What does that holistic and precision model look like? Imagine if dentists had all the information that they needed at their fingertips to tell us that, hey, this one diabetic patient needs to come in every 3 months for hygiene and we can watch that cracked tooth, while that other diabetic patient needs to come in every 6 months, but we need to treat that cracked tooth tomorrow. Or a medically integrated solution that would flag the dentist to evaluate that patient for obstructive sleep apnea, and we can intervene in that child's life much sooner for life-changing treatment. Initial testing of our solution revealed that collecting the right data, evaluating patient risk in key areas could increase practice growth up to 2.5 times. It accelerated existing care opportunities and brought to light new treatment opportunities for the dentist that they may have been previously overlooking. Benefits include increasing patient trust, dentist confidence, driving business growth, and supporting how early intervention is insurance payer friendly in the long term. OrQ's competitive advantage is that we are the only solution that captures data end-to-end in a clinical exam process for comprehensive risk assessments on dental patients that will be a source of truth for all stakeholders. OrQ's simple step-by-step comprehensive health assessment begins even before a patient comes in the door, followed by a simple dental exam in office with seamless integration into existing workflows. That's when the magic happens. Like Robin to Batman and Q to James Bond, our AI and machine learning brings the mind and the wisdom of 1,000 dentists to the center of the patient relationship. OrQ informs dentists of their patient's risk with key insights at their fingertips to uncover unmatched opportunities for patient care, giving patients easy to understand transparency, and driving business analytics to focus clinician education around the true needs of their patient base. Really fortunate to be part of this wonderful program, learned so much, and be participating in a validation study with our key impact partners, a federally qualified health center called the Heartland Community Health Center, and a large group dental practice called the Brentwood Village Dental Clinic. Some of the key insights and learnings that we took from this program and the validation study were that traditional dental exams today are capturing only close to 20% of the data required for accurate risk prediction. And how can we validate and quantify the value in collecting the remaining 80% as it relates to uncovering opportunities for care that are often overlooked, calibrating dentists to drive consistent and confident treatment planning in all areas of care, both basic, for example, hygiene protocols, to more high impact areas of care such as obstructive sleep apnea, worn, cracked teeth, and being able to look at how we can analyze this data to support, again, data that would help the payer model along with helping dental groups and patients and dentists alike. Our customer feedback surveys were overwhelmingly positive in terms of the value for patient risk profiles and driving a consistent comprehensive exam process of how that would support optimal treatment recommendations. And we're very excited to announce that both of these impact partners will be proceeding with beta testing our actual solution within a matter of a few months here. In the past 18 months, we've completed clinical and technology validation with reputable institutions. We've closed out OrQ's oversubscribed pre-seed round, raising $1.5 million in grant and investment funding, including investment from an oral health VC fund, and have participated in amazing accelerator programs helping us with clinical and market validation. Our MVP is launching into dental practices this month when we have over 25 LOIs signed from beta testing sites and an additional pilot commitment from a Western Canadian dental corporate group that's giving OrQ access to almost 30,000 patients. We have a conduit of over another 50 practices in the US and aiming to reach our goal of just under 20,000 subscribers in 6 years for an annual recurring revenue of $117 million. We have a massive global market opportunity of $9.6 billion. And in early 2023, we plan to launch to market as a cloud-based software subscription solution starting at $500 a month, promising a practice greater than 10 times ROI on this spend. I know I'm discussing monetary ROI here, but the true value in what our solution can build is from the source of truth data that is supported by quantitative and qualitative analysis that gives benefits to patients, providers, DSOs, groups, and dentists alike. So it's this source of truth data is really focused around integration and building trust amongst all stakeholders for a new model of care. Our co-founders and team are dentists, scientists, and developers who bring extensive knowledge as it relates to experience in the business and clinical side of dentistry, dental groups, and all sides of dental practices, along with knowledge as it relates to AI and machine learning, data science, and software development. And our advisory board brings extensive knowledge related to SaaS startups in the medical and dental and insurance payer space. Over the next 12 months, ORIQ is moving from testing to refinement to initial product launch. We'll be launching our $3 million seed round later this year to help us reach our goal of 100 paid users in 2023, expand our AI and technology, and build our team with the top talent. We're well on the path to making a huge impact for this market opportunity. Let's not allow patient care opportunities to slip through the cracks. Let's intervene early with an integrative approach to help change that child's life and save that adult unnecessary costs and pain, and create a model that truly gives access to care to patients everywhere, regardless of where they live or the background of the provider that they see. Thank you so much for listening in this opportunity today, and I look forward to welcoming further discussion at the reception later.
Please welcome to the stage from Chicago, Illinois, Auris DX, saliva-based diagnostics platform. Welcome co-founder and COO, Dr. Rifat Hasina.
Thank you. Hello, everyone. I'm Dr. Rifat Hasina. I have a degree in dentistry and a PhD in oral and maxillofacial surgery. For the last 25 years, I've been studying head and neck cancers in the lab. As a co-founder of Auris DX, I'm here to share our exciting invention of a non-invasive saliva-based test that is going to detect oral cancers. There it is. So, more than 60% of oral cancer patients come to our clinics in the late stages. That means more than 60% of patients are evading early detection. Early detection is important because it is highly treatable and it saves lives. When patients get treated in the late stages, not only do they go through extensive surgical resection, chemotherapy and radiation therapy, they have to go through lifelong comorbidities like lost voices, resected tongue, reconstructive surgery, and a lot of other functional deformities. This is devastating for them. And this is happening because the current standard of detection for oral cancer is visual inspection. And this not only fails patients, but it also fails providers because dentists who look at the mouths cannot definitively find oral cancers just by visual inspections. As a result, they end up overprescribing or underprescribing biopsies, which is a painful invasive method. And insurers suffer because late-stage treatment is many orders more expensive than early-stage treatment. So this is where Auris DX comes in. We have developed a test that is painless and non-invasive. It is highly accurate and it'll help detect oral cancers early. And Auris DX test will become the new standard of care. The reason this test is such a big deal is because of this world-class team that is behind us. The top row is the 5 co-founders. Dr. Nishant Agarwal is a head and neck cancer oncologist who treats these patients every single day and envisions bringing this solution to his patients. Dr. Betty Gowda is a liquid biopsy expert who developed this test, the science behind this test over the last decades. And Dr. Eisenchenko is a premier geneticist and head and neck cancer specialist. Jake Stengel is our CBO who has several years of business strategy in the biotech industry. Patrick Conniff, who is in the room today, is our talented market strategist who led the science, the SMILE program with me. So our test is based on a 7-gene panel of tumor biomarkers, which we developed after taking into account the tumor landscape of oral cancers. How we validated this test is by doing a clinical study, prospective clinical study in 121 patients. And we compared their tumor biopsy samples with their saliva samples to see how that works. And we developed a proprietary bioinformatic algorithm that showed that these 2 samples are very concordant. And we found out that our test is more than 93% sensitive and almost 100% specific, which means that this is a very accurate test with almost no false positives. So our vision is really that everyone, regardless of socioeconomic condition, their zip code or their insurance coverage, gets access to oral cancer screening. And we worked with the SMILE program to identify some of the barriers to integrating dental medical care and found some solutions to it. So while the treatment of oral cancer is a medical event, it really starts at the dentist office, because the dentist and oral hygienists are the people who actually look in the patient's mouth, and they're the ones who can identify it. So a patient with a lesion or a high-risk person comes into the clinic and provides a sample to the dentist's office, which is then sent to the OrisDx labs. OrisDx analyzes the samples, looks at the cancer mutations, and then the doctor, we send the results back to them, and they make the decision and fast-track the patient to get the treatment that they need with the oral surgeon or oncologist. And for those that have no cancer mutations and the result is negative, they can walk away with peace of mind and no biopsy is necessary, which comes back negative so many times. So this is really a definitive tool that is going to revolutionize the care for oral cancer. So what we did with the SMILE validation studies are that we found three critical things. With Colgate, we were able to reach 300 consumers with lesions, and they told us that a non-invasive test is very important to them because they do not like biopsies, which for them, 82% of the time, it came back negative. With Cigna, we were able to reach 638 dentists and asked what they wanted. They say the same thing, they want a non-invasive test. Not only that, they want a test that is reimbursable, and they want a test that is genetic-based. And this is where we also forged a path for dual medical dental insurance and medical dental integration. Because we figured out a way where OrisDx will be reimbursed for analyzing the test by medical insurance, and the dentist will be allowed to bill dental insurance for collection of the saliva sample. And this work was also supported by DentaQuest because they are so excited about it. They actually made a decision tree for us to forge this path. And I'm excited to say that we have actually a path forward to work with all of these three impact partners, amazingly, to develop our marketing strategy going forward. So at $500 per test, with 30 million smokers and 10 million drinkers, that's a total addressable market of 20 billion. Even if we capture 1/4 of it, that's a huge impact. And remember, this is only 10% of the world market. So we see an immense opportunity for global expansion. So OrisDx ventured into the commercialization market just this year and already raised $1 million and gained a lot of momentum. Our ask is another $1.5 million. And this is money we're going to use to conduct clinical studies that's going to replicate the previous studies that we did, but also include data for clinical validation, clinical utility, analytic utility, all of which is going to support FDA approval and insurance coverage. And so then we will launch the test nationwide and a global launch in future. So I want to end with a quote from Dr. Eric Pulver, who is an innovator, oral surgeon that many of you know, and a thought leader in patient-centered care. He has said that OrisDx represents a game changer. And he's not the only one. We've heard this word over and over again. We have actually developed a groundbreaking test that is definitive, that is reimbursable, and its ease of use will provide broader access to many, driving more equitable outcomes. So I hope you will join me in making oral cancer history. And thank you very much for listening. I look forward to engaging with you further in the reception.
Please welcome to the stage from New York, Sleep Architects, the dental industry's only easy, turnkey, digital experience for sleep health. Welcome CEO, Alice Lim Ka Kang.
Hello, everybody. How's everyone doing? Okay, good. All right. I am Alice Lim Ka Kang. I am delighted to be here to tell you how we are. Am I advancing? Advancing? There we go. Okay. I'm Alice Lim Ka Kang, the CEO of Sleep Architects. I am delighted to be here to tell you how we are democratizing access to the diagnosis and treatment of obstructive sleep apnea with our platform that is easy, turnkey, and rewarding for patients, providers, and payers. A little bit about me. I spent a good amount of my time right here in Boston, about 25 years building and growing healthcare companies from both an investor and an operator standpoint. About 5 years ago, after a successful exit with Boston Heart Diagnostics, based in Framingham, I started to turn my attention to something that is critical to each of us every day and every night, but we just don't think that much about. That is the simple act of sleeping. So if any of you have ever felt like this, hopefully not today, and especially not right now, you're not alone, because 30 million Americans suffer from a disease called obstructive sleep apnea. What happens is your tongue, which is a muscle, relaxes, blocks your airway when you're sleeping at night, and this intermittent oxygen drives erratic heart rate, blood pressure, metabolism that is linked very strongly to long-term diseases like obesity, diabetes, and more. The American Academy of Sleep Medicine says we have a national sleep crisis costing us $150 billion in lost productivity, accidents, and disease. And yet, as we heard earlier, it's still 80% undiagnosed. And worse than that, the impact is not equal. We know when income levels go down, education goes down, the amount of hypertension, diabetes, long-term disease goes up. And still, in sleep labs, minorities are way underrepresented, even though they have the most severe OSA. So why is this? Well, let's look at the patient journey. If you look at the patient journey for both diagnosis and treatment, it's inaccessible. There are only 4,000 specialist sleep doctors in the US, so getting an appointment even is hard to do, especially outside of metro areas. When you go for an in-lab sleep test, it's cumbersome and expensive, so nobody wants to get tested. And the frontline therapy, the CPAP, the mask that we talked about earlier, is hard to comply with. In fact, we validated a 68% non-compliance rate using the Smile Health's database, which is the largest longitudinal data set available. And even though it is covered by medical insurance, there's still a lot of out-of-pocket costs, disposables, cleaning solutions, so a cost is still a barrier to entry. So what's a patient to do? Well, there are alternatives. There are 200,000 dentists in the US who can treat patients for this with oral appliances that position your jaw and your tongue in a way that keep your airway open at night. And there are many designs of these devices that have actually been cleared as safe and effective by the FDA already, and it's included in the medical guidelines. So why aren't patients getting more? Well, we know that dentists have not been integrated into the medical system. So we have an example like Dr. Kalantari, who is a dentist who's been trying to treat her patients for over 3 years, working with sleep testing companies, medical insurance billing companies, trying to get education for her team, and hasn't been able to pull it all together. So it's no wonder with a disparate and confusing ecosystem like this, that patients can't get help. So at Sleep Architects, we have reimagined what an easy and integrated health journey should look like. We have created a platform for diagnosing and treating sleep apnea that is easy and low cost to get screened using wearables in the home and text messaging. Turnkey in bringing together dentists and medical providers that drives a rewarding outcome for patients who get healthier, payers who reduce cost and disease, and physicians who get to focus on clinical care. Our platform manages all that complexity, technology, and communication in the background. Our Sleep Connect technology platform screens people for sleep remotely, educates them on disease and therapy, and guides them through each step. Our Sleep Experts program coordinates between and includes medical, doctors, and dentists together. And we leverage new wearable technology to diagnose with convenience at a lower cost. And best of all, we also make sure that every patient, no matter their income level, no matter their education level, gets the same high-quality care because we're integrating sleep doctors and experienced dentists on every case. And our Sleep Now programs, products and services provides therapy options, which include oral appliances, and integrates payment mechanisms, such as consumer financing and medical insurance, so that payment isn't a barrier. The real secret sauce to our platform is that we manage all this complexity and make each part of the ecosystem work together in harmony. Right now, patients pay dentists for oral appliance therapy in two ways. One is typically out of pocket with a credit card. And we have worked to expand this pathway in and of itself by negotiating a national consumer financing program that allows every patient, regardless of credit level, A through E credit, to access a 0% financing option to pay for sleep therapy. We also manage medical insurance billing, and this applies right now to out-of-network insurance, so if a person has a PPO plan, because dentists are out-of-network largely with medical insurance, which is why we were so excited to be matched with Point 32 Health right here in Boston as our impact partner with the Smile Health program. And together, using that Smile Health database, the longitudinal database, we looked at the overall medical costs of OSA patients and found that those who are untreated for OSA drive costs 22% higher than those who are treated with oral appliance therapy. And with interviews and looking at claims data, we validated that dentists have real obstacles in working with health plans. It takes 3 times as long for a dentist to process an out-of-network claim with medical insurance for oral appliance therapy as it does for an in-network CPAP claim. Dentists just have not been integrated to health plans. So in recognizing this, we are exploring a unique relationship and pathway forward where we could possibly work together with sleep architects bringing a single contract to help bring dentists in-network with health plans. The health plan will be able to work with a single point of contact to streamline things and make sure that qualified dentists are coming in and driving medical and dental integration. And our platform will help drive that collaboration and outcomes. Dentists get included into the system and get paid for their work. So our platform benefits everyone. We are now launching into the DSO market to bring scale to a national access. And for DSOs, treating with our platform helps drive their same-store revenue growth and profitability without any capital investment or burden on their staff. For payers, we'll help drive costs down, disease down, and promote that dental medical collaboration. And best of all, for patients, we'll get better health, improved access at a lower cost. So, in summary, I invite you to join me in doing what we have to do, which is do better for the millions of people who need sleep health. We are launching into our scalable platform into the DSO market to expand reach. Our consumer financing and our medical insurance opportunities provide us fuel for growth, and we've just opened a $2 million financing round. So any investors out there, I'd love to talk to you.
Well, let's look at the patient.
Our team has proven an experience, and I myself have actually put a significant investment into Sleep Architects, not only because I believe in the mission, but also because I believe our business model will provide an amazing return on investment. We have new recent strategic investors, such as Delta Dental Rhode Island, Revere Partners, and prominent dentists who have joined us, who are providing us more momentum than ever before. So there's never been a better time to join us at Sleep Architects. Thank you.
Using the Smile data set available.
And even though it is covered by medical insurance, there's still a lot of out-of-pocket costs, disposables, cleaning solutions, so it's still, a cost is still a barrier to entry. So what's a patient to do? Well, there are alternatives. There are 200,000 dentists in the US who can treat patients for this with oral appliances.
Please welcome to the stage from Ann Arbor, Michigan, Waiver, a platform reimagining the patient experience through virtual reality. Welcome co-founders Joe Goff, David Wheeler, and Jamie Clarkson.
Thank you. Thank you. Hi, I'm Jamie Clarkson. I'm a plastic and hand surgeon. You might wonder what one of those people is doing in a meeting like this. Well, I'm about to tell you. I'm the Chief Medical Officer for Wide Awake VR, that is also known as Waiver. In Waiver, we aim to eliminate the fear that you see in this picture, well known to many dentists around the country, also well known to doctors. We wish to eliminate that fear and anxiety for those vulnerable patients by using immersive virtual reality experiences, and we're aiming to become the dominant healthcare platform for delivering these experiences. Fear and anxiety. Fear and anxiety is expressed by reluctance to attend the dentist and all the downstream problems that you get from there. In medicine where I work, it also leads to the overuse of anesthesia, which we now know has a 12% rate of cognitive decline in all of us who have a general anesthetic, and in particular for the elderly patients for whom outcomes can be radically worse. The evidence is in, and I stand on the shoulders of many previous publications, but I've looked at the use of virtual reality for my awake hand surgical patients, and what I found is that it decreases anxiety during their surgery, it increases joy during their surgery, and it also decreases the pain of the injection of the local anesthetic for those patients who have an anxiety disorder that was driving the pain. There are fewer infections when you take patients out of the operating room and put them in the office, and this is validated by a study that comes out of the Mayo Clinic, which also demonstrated significant cost reductions of up to 85%. I'd like to introduce you to my co-founder, Joe Goff.
Thanks, Jamie. So the power of Waiver is really encapsulated in the simplicity. It turns out that it is not very easy to make things simple in healthcare for the actual users. But that's why we gave them third-party control. We took a first-person technology that was operating in the consumer space, and we transformed it into a surgical-grade content management system that operates flawlessly under the most high-pressure scenarios. Obviously, if you ruin a surgeon's surgical day and disrupt it, you're talking about large dollars at risk. So it also requires no internet connectivity. So when you see this system, what you're seeing is a tablet that drives the headset. The tablet contains the content. It flows to the headset without the use of the internet. Many medical facilities obviously have that problem. So this creates that frictionless content management. Dr. Krell so appropriately mentioned the cupboard underneath your sink where all the innovation is hiding from the history of dentistry. We don't want to be on the island of misfit toys, so we spent a lot of time and energy making sure that the business-to-business side of this is perfected and the practitioners have a seamless experience. And we have a lot of those practitioners already on board. These are paying clients and research pilots. Trinity is obviously the third largest health system in the US, but Michigan, the Mayo Clinic, WashU, Rothman Orthopedics. If you're online looking at social media, you'll see Dr. Alejandro Badia down in Miami with South American patients flying in to have his concierge surgeries. Dr. Austin in Toronto doing aesthetic procedures. Dr. Alistair Phillips in the UK with the NHS. But really the perfect use case is what we've done with Kaiser Permanente. If you have a upper extremity surgery in Southern California with Dr. Croonan, you're going to come in to anybody in his orthopedic department, and your surgeon is going to come into the VR experience and deliver the preoperative instructions to you. Then you get the experience, immersive VR, entertaining. 15 minutes later, your surgeon comes back into the experience and gives you the postoperative instructions. Comprehension increases, compliance increases. It's a stickier experience for the patient. And Kaiser gets to brand the whole thing. So you're in the little movie theater and it's brought to you by Kaiser Permanente. And we think that all those things that we've learned in the medical space are now able to translate to what we're going to do in the dental market. So this is the crossover effect. And we couldn't be happier with the partnership that CareQuest and Matter Health have delivered for us with the Impact Partners, 42 North Dental, and the Columbia College of Dental Medicine. These partners, who are all now moving forward, they all have units, they've all deployed the units and are using the units, have taught us a great deal. We made a full pivot on this. So talk about learning things from an accelerator program, it's been amazing. We learned that our headsets work very well for certain procedures, not so well for the dexterity required in other procedures. So we're working with HTC and Pico to get a lower profile headset, less cumbersome for certain procedures. The more important one, though, was the overall study and the validation of the use cases. What we found is that going upstream in the hygiene appointments, in the cleanings, was actually validated at a higher level than some of the things that we thought were more acute, more exhaustive. The experience that can be defined with 90% of the claims in dental being in the hygiene side of it, allow an entry point where now the patients can feel like, when I follow my treatment path into further things that might be more painful, more scary, I know the environment I'm going to be in. I know what I'm going to have in the patient experience. So virtual reality can be the onboarding to a flow to get more people to come to the dentist, no fear and anxiety, and more people to flow through their treatment plan with less obstruction. And the quote that we just absolutely love from Dr. Slaba at 42 North really speaks volumes. If we can be this for the dental industry, driving patients for preventative care, everyone benefits if more patients get more preventative care and aren't fearful of this experience. We know there's competition, and the beauty of this is that our competition is not in the surgical space. They haven't gone into the highest pressure environments. They're point solutions that address disease states in most cases. We want to be that ubiquitous platform. And quite frankly, we want to host these applications on our platform. We've perfected the delivery system. Now bring all the point solutions that have FDA approval onto a platform, because health systems do not want to deal with 12 VR platforms floating around their hospital. One platform, all the applications sitting on the platform. That's our hope for the future. And that's really part of the advantage that we think we've created with the differentiators. Yes, we've got a 2.5-year head start in surgery, and we've got all the renowned wide-awake surgeons on board, but we also have a patent pending on the patient safety system, which we think is very important, and we have world-class content. The content curation is hugely important, and that content is championed by the former chief creative officer of EA Sports, or EA Games, and a pioneer in delivering multimedia, and it's David Wheeler.
Can you believe it's taking 3 of us to make this delivery? We're already over time, so I'll be very brief. This slide is a glimpse into our library of that world-class content that Joe was referring to. So can you imagine sharing a gravity-free experience on the space station, on the International Space Station with astronauts? You can do that. You can plunge into the ocean and go swimming with a blue whale. This is really, and talk about immersive. So we are also now just beginning to create our own original content, and this gives us the opportunity to really design specific experiences that will service the needs of our patients and the procedures that they're going through. So we feel this is a good opportunity for investors. We've just started our seed round. We've already raised $600,000 towards our $2 million goal. And that's against a $8 million pre-money valuation. Remember her? With Waiver, we intend to go from this to this. We have kits with us. You can come and join us during the reception, and you can get a little bit immersed if you like. I'd like to thank you very much, and if you'd like to contact us, please go to our website. We can get through to us at Wide Awake VR. Thank you very much.
Please welcome back to the stage Maria Filipova.
I won't mention name because I promised I won't, but I was in the back enjoying the conversations here, and I kept hearing people saying, wow, we've got celebrities here, because some of our guests here today have been playing your games as they were growing up. So when you walked on stage, there were some quite excited reactions. I'm sure some of it transferred to Waiver as well, but they were very excited about the video games. And so with that in mind, we're in a very special place in the program where I would like for us to, first of all, acknowledge the tremendous work that all these companies and their impact partners have accomplished in the last 15 weeks. And I want to give them a round of applause for that. I would also like to invite to the stage and offer some closing remarks a brilliant leader, a visionary, and a change agent who has made it her mission to embody the principles of integrated care, of leading with empathy and compassion, not only as a medical officer and a CEO of a medical center locally, but also as the Chief Executive Officer of CareQuest Institute for Oral Health. It is my privilege and great honor to invite Dr. Maisha Minter-Jordan to join us and offer a moment of reflection and closing remarks for us today.
All right. As the closer, I stand between you and the cocktail hour. So I will be brief. But I've just got to say, the energy in this room is palpable. I am so incredibly proud of all of the work that has been done to bring us to this day, and really excited about the future. As Maria said, this centers on our mission. When I think about how we envision healthcare to be, as an internist, as a physician, I've always been centered on the fact that healthcare needs to be equitable, integrated, and accessible in all manners, in all forms. And so it is no surprise for me to have come to this space of oral health to say that this has to happen, that oral health has to transform as we have worked to transform the entire medical system. So I'm really incredibly pleased to hear about all the levels of integration and all of the thought that has gone into what is the patient's experience as they enter into the healthcare system. How do we better empower them? How do we empower our providers to be able to make better choices, to be able to partner with our patients to improve their overall health outcomes? So that is where we begin, and that is where we end, always with the mission. So as I think about our mission, which is really to focus on improving oral health outcomes for those who are marginalized, for those who are underserved, of those who are forgotten, who aren't at the table, by bringing forth an equitable, accessible, and integrated oral health care system. But I'll also just say this very quickly. The reason that oral health came in terms of my overall experience as a physician and came into the forefront for me was as a provider at a local community health center, as Maria mentioned. I came into that health center and understood that the children in our early Head Start and Head Start programs, when they had caries, when they had cavities, they were being put to sleep. And you think about a 3 or 4-year-old who will not sit in a chair and allow a dentist to drill. The alternative is to put them to sleep. Completely preventable disease. And so one of the things that I took on initially as chief medical officer and later as the president and CEO was bringing our dentists into those programs to educate the families, to educate the teachers, and to make sure that we were moving the needle on preventing unnecessary exposure to anesthesia of our children. So this, for me, is exactly where we need to be. This is exactly the right moment for us to be doing this work together. And when I joined the CareQuest Institute team, I challenged all of us as to how we were going to move this forward. How could we take every asset underneath the CareQuest Institute umbrella and bring it forward and bring it to bear on moving the system, of transforming the system? And this is one of those amazing ways in which we're doing that. So as you've seen today, here we go. At CareQuest Innovation Partners, we're creating the future that we want to see. In that role, we draw on the research that we do, we draw on the expertise of the CareQuest Institute team and of our innovation partners, and together we share this mission of improving the oral health of all. We also collaborate with organizations like Matter, which has been fantastic, a fantastic new collaboration for us, to understand how do we impact the ecosystem of innovators to move forward in this space? How do we inspire and open the doors to the possibilities within the oral health ecosystem? And at the end of this program, we've gathered invaluable learnings. I've learned so much today just by hearing from each of the teams. Different ways in which we can take on the onus of moving the system, transforming the system, engaging providers, understanding what are the business concepts that we need to move forward in order to make this work sustainable. Having a business background, I always came to every problem within healthcare with the moral case and the business case. Because if you don't have the business case, it will not be sustainable. And the worst thing that you can do to any community is to bring innovative solutions that then go away. We're not here to do that. We're here to create sustainable solutions that transform this system. So at the end of today, I hope that we've all gathered these invaluable learnings that we'll take forward with us and engage with the companies that presented to us today to continue to allow them to continue to do this work and to find pathways towards sustainability. All right. Here we go. So we have a lot of reasons to smile, pun intended. We know that from snow-capped crowns that they're working with Glidewell Laboratories. We know that they've completed scans of over 200 children, showing that current crown options are not able to meet over 29% of the sizing for children's teeth, particularly in indigenous and underrepresented children. And I just want to pause there for a second. We often think about solutions that are one size fits all, but we often don't remember that the all is inclusive of those who are underrepresented and often don't have a voice at the table. So the fact that this company is pushing that forward is absolutely incredible, and I'm so proud that we are engaging with this company. OraQ and their impact partner, the Heartland Community Health Center and Brentwood Clinics. We've heard from them today about the work that they will do together. And as a former leader of FQHC, or Federally Qualified Community Health Center, I'm so excited about the potential there to work on the beta version of their product as soon as this year. OrisDX, they'll continue their work with Cigna to develop a cost-benefit analysis of early cancer detection versus current state, late-stage diagnostics and treatment. The objective for them is to develop the business case and to pilot an integrated medical dental benefit for self-insured employers. We're excited about this trailblazing path that they will take, and we hope that this will extend to other insurers as well. But the fact that we are thinking about oral cancers, and thinking of ways in which we can make sure that dentists and providers are talking to one another is revolutionary. Like, how many times have you gone to your primary care doctor and they've actually had an interaction with your dentist? It doesn't happen. And so the fact that we have companies out here that are doing this work of bringing these two provider groups together is transformational. Sleep architects are in discussions with Point32 Health to become an in-network provider. Can you imagine dentists as an in-network provider with a medical insurance company? Who knew? But this is the work that we need to do in order to make sure that we're breaking down these silos. As we heard earlier, way back, there was this decision made that medical providers and dentists shouldn't work together, that we should be siloed, that we shouldn't share information. And companies like Sleep Architects are breaking those barriers down. Again, incredibly proud of that work. Waiver, I can't wait to try the VR, I have to tell you. I've never tried it before, so I'm so excited. But just the fact that they're working with 42 North, Columbia Dental School to pilot the next version of the product, currently in production in the next 6 months, amazing. The fact that we can actually transform the experience of the patient. I will tell you my own experience going to the dentist, there's a lot of trepidation and fear. But the fact that I could potentially transform my experience sitting in that chair to improve my health is absolutely incredible. We have to continue to think about what the member's experience is, what the patient's experience is, in order to transform healthcare. They can't be left out of this discussion. So the fact that Waiver is focused on that is really amazing to me, and I'm just really excited about all of the potential there. But throughout all of this, each of these teams have grown their business acumen. That's what this is about. This is about validation and scale. And through the validation, we heard each of the teams talk about the ways in which it has grown their business acumen, the ways in which some teams have actually made a pivot in order to incorporate the information and the learnings of our program. And we could not have wished for a better outcome. We know that many are in talks with investors at this time, and we'll be able to continue to share the outcomes of those conversations in the coming days and weeks. And what an amazing opportunity for us to see these companies continue to flourish through our actions and through our partnership with each of them. So finally, as a bright example, and how cool was it to see Lenny Kravitz, by the way? Like, I did have to take a picture and send it to my kids so I can stay on the cool list with my teenagers. But we are so excited of our for-profit and nonprofit organizations working together. And as Dr. Mike Monopoly shared, the CareQuest Institute for Oral Health is collaborating with Lenny Kravitz of the Glow Good Foundation, Boston University School of Dentistry, and our Smile Health startups to deploy integrated care models to rural communities and develop the longitudinal evidence and data needed to deploy at scale in the U.S. So excited about this work, so excited about this potential. And the idea of creating these partnerships because we know we can't do this work alone is absolutely phenomenal. So really excited about that. And I'm hopeful that I'll get to fly on somebody's jet and go to Eleutheria. Haven't been, but it's on my list. But most importantly, and more importantly, as a joking aside, the impact of that work on those communities and being able to take those models and translate them into other models within the U.S. is what I'm most excited about. So finally, let me just say thanks. Before we celebrate, let me just say thank you. Thank you to our team, to Maria for her leadership. Maria's over there. Thank you, Maria. To Kirill, to Johnny DeGruder, Eva Litchfield, Jeremy Horst, Jerry Duncombe, Kristen LaRoche, Denise Marks, Patty Ma, Kaz, Eric Tranby, all of our amazing, amazing team members who were instrumental in the success of our first attempt to do this work and to really double down on what CareQuest Innovation Partners can do in this space. And also thank you to our board, many of whom are here today, for the support. Without our board and having a supportive board, we would not be able to do this work. So thank you so much. Our board members, please just raise your hands. Wonderful. Thank you so much. Thank you. Thank you. Good to see you, Jessica. And finally, I will wrap up by just saying congratulations again to each of the teams and to our partners. Thank you so much. 42 North, Cigna, Colgate-Palmolive, Columbia Dental School, Delta Dental of California, Delta Dental of Washington, Demos, DentaQuest, Dental Markets, Enable Dental, Glidewell Laboratories, Heartland Community Health Center, Point 32 Health, Mouthwatch, that's a mouthful, Mouthwatch, Revere Partners, Sia Ventures, and finally Spring Rock Ventures. Thank you all so much. Please enjoy our cocktail hour. Please get to know one another. Test out the VR after me. I'll be the first in line. But please really get to know these companies. They're doing tremendous work, and we're so, so proud of all of the work that has been really, this is the culmination of so many efforts, and we're really excited about today. So thank you for being here.
Choice is theirs, and theirs alone.